Good morning, everybody, and welcome to the Thursday, July 9th meeting of the Prison Board of Inspectors. We are going to start by establishing a quorum. This is Mike Pipe. I'm here in my home in Boalsburg. Do we have our Vice Chair, Commissioner Dersham?
President accounted for, sir.
Okay. Do we have our Controller, Jason Moser?
Yes, I'm here.
Okay. Do we have our Judge, Judge Oliver?
Yes, I'm here. Thank you.
Okay, super. Now, Sheriff Brian Samsel?
Yes, I'm here.
Okay. We will, Commissioner Higgins as well. Commissioner Higgins.
Present.
Okay. And District Attorney Cantorna hopefully will be joining us soon. But we do have a quorum and we can get started. We will at this time accept any public comment for any item not have on the agenda today. Will there be any public comments? And if you have public comment, just unmute yourself and we'll recognize you. Okay. Seeing none, we're going to move into the approval of the minutes from our last meeting. And this would be for the June meeting. Will there be a motion? And just to make sure, Chris, on the agenda, we just have the May BOI, but we had 2 meetings in June. Would we be able to approve both meetings today? Meeting minutes?
Yes.
Okay, all right. And Denise had sent them out in a separate email. So any questions on the minutes before we look for a motion to approve both sets? All right, hearing none, will there be a motion to approve both sets of minutes for the June meetings?
So moved.
Second.
Been moved and seconded, moved by Commissioner Dersham, seconded by Jason Moser. Any further discussion on the minutes? Hearing none, all in favor say aye. Aye?
Aye.
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 Okay. Any opposed? Say no. Okay, hearing none, we'll move into the agenda. Actually, recognition, Chris, we don't have any staff awards today, right?
Correct. I apologize for that.
No, that's okay. That's okay. All right, we'll move into the monthly reports. Turn it over to the warden and his team.
Good morning, everybody. Starting off with our returning citizen service report. A year ago, she's seen 60 people. Of course, at that time, we were not in this pandemic. This year, this June, she talked with 7. She referred 4 to PSU Psych and 3 to Crossroads Mental Health. Since we've started our programming with Dr. Wolf, we have 4 individuals returning citizens being seen by Dr. Wolf and his assistant 4 times this past month. We're actually increasing that to all day Wednesdays is going to be Dr. Wolf morning and afternoon sessions until we get more equipment to be able to do the group sessions. Dr. Wolf already saw 12. He saw 12 of our staff members this past month, and he's going to be meeting up with them in another week or 2 with the same 12. Crossroads Drug and Alcohol. We have they're doing individual counseling sessions. We have 2 males. They've seen 4 times per month. 0 females at this point, but they're continuously doing assessments to add females to the drug and alcohol. Mental health group, we had 3 males seen individual 4 times per month. We have 2 females that's being seen 4 times a month individually. Center County Compass program replaced Pride and Choice. The male group has 13 returning citizens. They see 3 times per week. It was 2 weeks. The program's been going on for 2 weeks now. Female group is 5 returning citizens. They meet 3 times per week, and the same thing as they've been. This is going into their actually 3rd week and coming into this week. Release community reentry workers. Centerpiece, we have nobody eligible at this point. County maintenance is 0. We have 2 on the grounds. Work release is nobody's eligible at this point. A year ago, we had 10 returning citizens eligible for work release. Work release non-eligible snapshot of June 30th, 2020. So we had total of 19 individuals. We have 2 working. One person that's sentenced refused. We have 4 individuals that have a history of being a non-compliant with our policy and procedures within our facility. We have 4 individuals. It's the nature of charges. They're pretty heinous charges. That's why we're not letting them out on any type of work release. We have 3 that's pending new charges. We're trying to get those resolved as soon as possible so we can get them out to work release or community reentry. We have 2 with detainers, out-of-county detainers, that we're trying to get those resolved as well. 1 individual was removed for work release for being non-compliant, and we currently have 2 in quarantine that are sentenced, and we're waiting for their 14 days that should be soon coming up that we'll be able to move them down to work release at that point. Our Center County population, again, is a snapshot of June 30th, 2020. Our total count at that point was 149. Center County population, we had 77, 11 females, 66 males. Unsentenced individuals were 56, 7 females and 49 males. County sentence was 19, 4 females, 15 males, and we have 2 for state sentence, and they are males waiting to go upstate. Our Tenon County population was 72, 18 females, 54 males. Unsentenced was 37, 15 females, 22 males. County sentence is 31, 3 females, 28 males. State sentence, we have 4 males waiting to go to the upstate. Our demographics of returning citizens, again, I took this snapshot on June 30th, 2020. Age profile, we'll start off with the youngest is in the blue, the darker blue is 18 to 24. It's at 12% of our population. 4 females, 19 male. Our next population is 25 to 34. It's 32% of our population. 15 females, 46 males. 35 to 44 is 16% of our population with 4 females, 29 males. 45 to 54 age is 10% of our population with 4 females, 15 males. And 55 and over is 30% of our population with 2 females and 12 males. Our ethnical summary, our Black African Americans, we have a total of 15, 12 males, 3 females. Hispanic, we have 3 total, and that's 3 males. White, we have a total of 131, 35 females and 36 males. Continuing on with our behavior modification status, Tier 1, we have 3 individuals. Tier 2, we have 1. Tier 3, we have 0. And Tier 4, we have 13 out in general population. Our co-occurring disorder, mental illness, and drug addiction. A year ago, we had 24. Not sure what our intakes was. That's one thing that we're missing on our platform there. June of this year, we had 25 co-occurring disorders that came in out of 81 intakes, 30.9% of our intakes that month. All on medication. Out of that 25, 15 was from center, 10 males, 5 females. And then we had 10 from other counties, 7 males, 3 females. Suicide watch, a year ago, we had 11. This past June, we had 16, 13 from center, 11 males, 2 females, 3 from other county, 2 males, 3 females. Out of the 16 that came in that went on suicide, 3 of them were detoxing off illicit drugs, 3 from center, 0 from other counties. The detox total a year ago in June was 40, 35 from center and 5 from other counties. This past June was 23, 16 males, 7 females. Out of that 23 was 15 from center, 12 males, 3 females. 8 was from out of county, 4 males and 4 females. Our substance detox numbers, heroin and opiates took the lead this month with a total of 8, 3 from center and 5 from other. Benzos is 3 from center. Meth is 2, 1 from center, 1 from another county. Alcohol was a total of 7, 5 from center, 2 from others. And 3 was our multiple. Heroin and benzo was 1 from center. And heroin and meth were 2, and they were both from center. Our FIMAT numbers, again, we have not done anything due to COVID-19, no new injections at this time. We are looking, we're going to reach out to them end of this month and see if they're willing to start trying to do injections and move forward on that. The prime care report, inpatient, we had two individuals, 2 returning citizens total for 2 days, 1 for uncontrolled blood pressure 1 day and 1 for attempted suicide for 1 day. Our COVID-19 test results, returning citizens test, we had 6 positive way back in April and negative 18, and we have 0 pending at this point. Total seen by the physician and PA a year ago was 102. This past June was 65. Total medical transport to outside physicians a year ago was 16. This past June was 10. Our mental health clinician, she's our mental health from prime care that sees individuals. A year ago, she's seen 326. This year, she's seen June is 118. Our mental health patients on psychotropic medication, a year ago was 158, but our ADP was 272, which was 58.1% of the population. This past June, total of 85 with a ADP of 128 with a percentage of 66.4. A daily average patient diagnosed with mental health, a total of 92 out of 128 ADP. Category C, a year ago we had 121, which was 44.5% of our population. This year we have 79, which is 61.7% of our population. Category D, a year ago was 23, which was 9.9%. This year is 13, which is 10.2%. And what I'm going to do is with the psychotropic medications, I'm going to actually hand the baton over to Glenn, let him explain a little bit about the psychotropic medications at this time, so that's okay, or do we want to do that later, Commissioner Pipe?
No, why don't we do it now, Chris? Yeah, thanks.
All right, thank you.
There we go. We had medical prepare us a list of the 85 inmates that are on psychotropic medications. There's a total of 27 different medications that they prescribe for inmates at this facility. Right now, the most prescribed medication is Vistarol. We have 33 inmates prescribed on that. Remeron is the second most prescribed. We have 32. Buspar or Buspar is 17. Trazodone is 17. Seroquel is 16. Prozac is 10. And then the rest are just scattered through. They fall into different classifications of medications. Again, all for mental health treatment. There's 12 different classifications which they fall into, which I won't go down through them all. But these are the ones, and it seems as our population percentage is high, but that's because our population is actually low, and the majority of people who were released weren't on mental health medications. So that number, while it's accurate, it seems to be a false high, if you understand what I mean. If we had 250 inmates in here right now, that total number on medications may increase, but our overall percentage would probably come down. Again, I won't go into names of what inmates are on what medications. If you have any specific questions, I'll be glad to try to answer them for you or get answers from the medical professionals. There was 2 months ago, I think we talked about melatonin. That is something that we were initially told that they had prescribed as medication, but they do not prescribe melatonin here, nor is it available in our commissary. Anybody has any questions? We'll try to answer them for you.
Okay, folks. So what we'll do is we'll open it up for any questions from the monthly reports from the warden, and also take any questions that you might have for Deputy Warden Irwin discussing the medications. So any questions, feel free to unmute yourself. We'll take questions first from the Board of Inspectors. Once we're done with that, we'll open it up to any discussion or questions from our guests joining us. Okay. Hearing no questions from the Board of Inspectors, any questions for any of the guests that are on the phone or feedback at this point for those items? And again, you can just unmute yourself and speak away. Okay. Seeing no questions or comments for those, thank you both, gentlemen. We appreciate it. And we'll head on into our old business, discussing the operations of the facility as it relates to COVID-19. And we'll turn it back to our warden.
Inmate grievance, this past June was a total of 9. A year ago we had 40, 0 non-grievable. 9 grievable found was 0. Grievable was 2, 0 found it. 1 was appealed to deputy warden status, 0 was amended, and to the second level appeals, 0 was there. 7 was refused for multiple reasons, probably for frivolous reasons. Central booking number, June of 2020, we had 124. A year ago, we had 217. We're down 93. We processed 11. On 11 to 7, we processed 8. 7 to 3, we processed 34. 311, we processed 82. We have opened up central booking in evening shift for scheduling prints. So we are actually done for the MDJ and the courts, and now we open up for anybody with applications and so forth. But they must call in, and we have set times that they must meet. There's 11 slots every evening to be able to be fingerprinted. Of course, they must come in. They must wear a mask. They must be temperature checked and fill out a form of questionnaire. And as long as everything's no on that form, we can move them into our central booking and forward with the fingerprints and move forward. So, but we have time slots set that nobody's waiting for any period. So once they get one done, there's time for our central booking officer to be able to clean everything down, clean the vestibule and the chairs and so forth. And then the next meeting, then the next appointment can show up at that point. So they really worked it out. Coordinator Andrews and Mike Shear really worked at the time frames out of how long it takes to print somebody and how long it takes to clean everything up to make sure that time frame works for everybody to keep our social distancing. Going into the old business, as Commissioner Height mentioned, our programming, like we said, we started with our Dr. Wolf, our Crossroads, and that's increasing. As soon as we get more equipment inside the facility, which it is ordered and it should be in any time, we're able to start doing more groups with Crossroads and do groups with Dr. Wolf, and as well as working with the meditation for men, yoga classes, and so forth that we're all looking to start to implement sooner than later at this time. We are going to be looking at reaching out to some of the religious groups that usually comes in on the evenings if they're willing to do a virtual meeting with those as well, because there's evening time. The evening slots are open to use our equipment, so that's another thing we'll be reaching out here in the near future for. Any questions with programming?
I had a question about the parenting program, and I work with Jeff Hyde in terms of assessing how many people would be eligible to do that, and then work on scheduling that when you have an opportunity.
Okay. And you'll be doing that virtual, correct?
Well, I'm assuming that's the only choice.
Yes, it is. I mean, some people, that's all they want to do, and that's fine. We'll have to set that up. Again, like I said, if they're coming from different housing units, we'll definitely have to set up a couple different computers for those in those rooms, and that's what we're lacking right now. It's just our computers, but they are ordered. Good things take good time, so that's what we're working on right now. So I'll talk with Jeff Height about that and see what we can work on that. Okay.
Sure, and it will take us a little bit of time to change to virtual programming. We're not ready to do that quite yet.
Okay, and you have booklets, right, or pamphlets, or
Well, that's what we would probably do. Instead of handing out materials each class period, we'd prepare a booklet so they have that right from the beginning, and we wouldn't have cross-contamination then.
all right, that works. Thank you.
Thank you, Connie. Any other questions specifically on programming? Chris, in terms of the mental health, the Board of Commissioners approved another year with Dr. Wolf. Out of curiosity, and this could be for any of the providers that you're working with for programs, but have they talked to you about the efficacy of it in person versus virtual? I know that you and your team have been really good at identifying programs and keeping programs running if they've had a positive effect on the individuals within the facilities. And Dr. Wolf works not only with the incarcerated folks, but also with our staff if they need any assistance with the mental health. And so I just was curious if they've mentioned anything about, how well the programming would work over a virtual setting. I mean, in this era with the pandemic, we're going to have to take it, however they can provide it to us. But I just was curious if they had mentioned anything about that.
Just referring back to individuals that are being seen now with them, their temperament in the sense have decreased. They're not so per se high strung with being agitated, anxiety, and so forth. So one individual I can think of is kind of, he came down a little bit and he's starting to listen to the rules, he's starting to abide by the rules and so forth by talking to them. I know in the past there's certain individuals that will not talk to somebody through a like a telepsych or through a computer or through a screen virtual. We have not had nobody so far. If that would happen, we would try to schedule somebody to come in and maybe talk to them through the non-contact visit room if we needed to. If we needed to see a psychologist from Prime Care, we would probably have one of those doctors come up and actually see the individuals face to face. We have done that in the past, and I know the pandemic happened and we try not to bring people into the facility, but in that sense, when somebody's in a manic state and they need to see somebody face to face, we have to make that happen. And we're not far from saying that we won't do it. It's just we would have to do it for their mental health stability.
Okay, thank you, Warden. Any other questions, comments on programming?
Mike, I have a question. This is Janet, and I'm sorry, it's actually for Glenn about the previous report. Is it okay if I can ask that question now?
Absolutely, yes.
So I'm just trying to get a handle on the people who are on these kinds of medications. Do you have the ability to figure out what percentage of those are sentenced and what percentage of those are unsentenced?
Yeah, I can, but not instantaneously.
Yeah.
Yeah, right now we have 19 total inmates sentenced in the facility. So I don't know how many of those are on this medication.
So the vast majority of them are unsentenced, even though you can't quite tell me exactly how many. So that I'm just processing what would have to happen in order to make it less burdensome on the facility to handle so many difficult mental health cases and, where they are in the process. And so what can we do to provide them with some alternative treatments even before they wind up in the facility? So that's the reason for asking whether or not they've already been sentenced. Thank you.
Okay. Yep.
Just one thing, Janet, on that. I think the police departments, the MDJs, the courts, they have tried and they do a great job with trying not to bring everybody in here that has mental health and try to divert them to other resources out in the public and out in the community. And I think they do a great job. However, there's certain ones that restrict them from not being able to find other resources in the community, and that's why they have to come in here. So, and when they do, we do our due diligence by making sure that they're being seen, being treated, and trying to do the best effort forward for them.
So that's a really helpful answer, Warden Shell, and I appreciate it so much. And I would be, not now at this setting, but would be interested in understanding how that diversion process happens. And I love the fact that you're saying how much you work together with getting ready for people that are inevitably going to wind up in your facility. So thank you for that.
Okay, any final questions, comments on this section? Okay, in terms of visitation, this would be strictly, Warden, this discussion would be strictly for not programming, but individuals who are coming in to visit family, friends, etc.
Correct, sir.
Okay, we'll turn it back over to you.
Okay. The visitations, I've been getting a lot of phone calls about having the public come in to our facility to have visits. I did a quick survey across the country or across Pennsylvania with our fellow county and so forth. We're looking at what they're doing, and everybody, probably the only one that was actually looking to open up their visitations was Butler County. However, they prolonged that right now until August 10th due to the spike in Allegheny, since they're so close to Allegheny County in Pittsburgh. So they actually took that down off their website and says it's postponed to August 10th as long as the numbers are stay stable. No other county is really looking at visitations due to the fact that it's just our housing is a little different than some of the other counties. Due to the fact is they have to cross-contaminate their units have to be cross-contaminated in a sense where they all join together and go for a visit, where we have ours individually. We're trying to get us set up for the time for us to be able to open visits, but I'm not sure if we're ready yet right now. I know Center County is kind of half stable and not stable, so I'm just kind of worried, but there is parameters that we put in. I have some things drawn up for when we're ready to do that. In a sense, of course, everybody comes in our facility would need to have to wear masks, temperature check, and questionnaire. They must keep the mask on the entire time during the visits. We have decals that are be on the floor that everybody must stay away 6 feet from one another, as well as our seating would be distanced 6 feet from one another from that point. Everybody would have to wear a mask except people that are 2 years and younger would not wear a mask at that point. So it's just discussion right now, but as when I reviewed through all the counties and talked with those, not many people are looking to open up visits yet until August. Their goal is August possibility, but they could postpone it until September as well. So I'm just letting that to the board to discussion.
So, Warden, would it be fair to say the recommendation right now, from what you're saying, is you would keep working towards getting policies, getting things in place, and it sounds like it potentially at the August meeting, we may revisit this again to see if it would be something that we'd want to do at that point. But for right now, you would still look to, if we still stay stable, have low cases, you would still work on policies to try to make visitation open and available. But at this point, you wouldn't be doing it necessarily tomorrow.
Correct, sir.
Okay.
Like I said, I'd like to table this for August meeting, and then at that point we can get into a deeper discussion if we're going to approve sometime in August for the visits at that time. But we'll still work on setting the visitation area up and setting our access to our cameras with our visitation officer, and just making sure everything's safe for the community to come in.
Thank you, Warden. Any feedback from the prison board on this?
This is Mark. I have a question. I'm having a little trouble with my video. So, Chris, for visitation, I think it probably breaks out into several different groups. how soon could we possibly hope to have family members come and visit our returning citizen?
Well, we're looking at August meeting to discuss in detail. I mean, like I said, it's not going to take us long we're working on our community, the public entrance right now with everything with plexiglass and so forth, and just putting our decals down and just setting up. We already have our time frame for visits. There'll be a half hour between each visit, so there won't be people congregating in the visitation area lobby. So it will be a half hour to where the officer's able to exit everybody, clean everything down, get upstairs and clean everything off, and then move forward to the next visit. So that's what we're at right now. Right now, I'm not sure if we're ready to do that. I think as we've talked with Commissioner Pipe here just a minute, saying that we might table it until August, and then we'll go into deeper discussions at that point of setting a solid date for opening visitation up.
Because certainly due to cleaning concerns and air cycling concerns, our capacity will be reduced. And we need to be very concerned about community spread. But I suspect at some point, especially some of our citizens who were in for longer periods of time, they're probably really missing some of their loved ones.
Yes, I agree.
I have a question. Excuse me. I have a question about the use of FaceTime, the iPads. Can they visit with their family that way now?
Yes, they're able to they have tablets used to be able to visit with their families, and they've been using that. Majority of people use phone calls. They don't use the tablet so much as doing the video visitation. There's a few that use it repetitively, but majority of our population uses telephone to be able to reach out to their family members.
Are they being charged for those calls now?
The phone calls or the visitation?
Either.
The phone calls, they receive, we have to renew a agreement with GTL to give them 2 free phone calls. That actually lapsed on the 1st, so we have to actually open that back up. I got to talk with our vendor and ask him to open that back up. And the video visitation, of course, is charged through the tablets.
Can you tell us how much that is?
Not off the top of my head. I'd have to go back through the contract. I don't know that off top.
I guess I'm encouraging you to look at the possibility that if they can't have visitation in the non-contact room with their families and they want to do it on the FaceTime, that they are able to do that at no charge.
Okay.
Thank you for that suggestion, Connie. Thank you. Any other feedback from the prison board? I think Connie raises a good point on that, but any other feedback, comments? Okay. Please,
Michael,
please.
is it okay if I ask a question?
Yes, please. Yes.
So I'm pretty sure Chris talked about this in a previous meeting, but right now, what is the access of people in the facility to their attorneys? How is that working out?
With the attorneys right now, what they're doing is if they have a public or if they have a private attorney, they've been calling in and talking with them privately in a room on a phone. We've offered if they want to do it virtual, they all opt to do it by a phone call. Public defenders, they've been coming up, seeing them through the non-contact glass. And that's I think it's only like 2 of those. 2. Yeah, 2 has done that so far. All the other ones have been talking to them on the phone. We give them the option of how they want to do it. We give them 3 options: phone, virtual, or through the non-contact glass. And majority of them, besides, like Melanie said, 2 individuals or two attorneys came in and actually saw them in that. And I think because they needed paperwork signed. But I know Attorney Merrill, she'll email us paperwork to give to their clients to sign off, and then we send it back to her and so forth. And that's been working out real well. We've been working well. Our counselor's been doing double time with attorney calls. I think last Thursday, I think it was like 20 or 25 attorney calls came in that came across the radio that was there a free counselor to be able to take an attorney call. So that's been a high increase, and it's been putting a lot of burden on the counselors at this time. But it's something we have to do at this time if they're not willing to come in to see them virtual or do the virtual meeting or doing the non-contact visit. So yeah, they have full access to their attorneys.
So if I could just follow up, in order for them to have a phone call, it has to go through the counselor?
To the attorney?
Yeah, if the attorney wants to talk by phone to their defendant, it has to go through the counselor?
No.
They can always use the regular phone.
No, they have opportunity using the regular phone in the housing unit. They have options. But what happens, what I'm talking about is when attorneys call in and they want to talk to them, talk to their client. That's when they go through the counselors, and the counselors set those time frames up so they can come up and be in a private setting. Because sometimes you don't want to talk to them in the unit, so they set it up. They bring them up to the room there so they can have privacy.
Got it. Okay, I understand now. And then you said there were 3 different options, these phone calls that are set up by the counselor in a private room, the non-contact visits by public defenders, which is not happening very much. And then you said virtual. And what did you mean by that?
We have a Polycom virtual system that can connect to other Polycoms, or they now know how to connect to Zoom. So I've set up a couple of further distance attorneys that had a pretty serious case. They wanted to be able to talk face to face like we're doing now in a private room.
I see. And go ahead.
I was going to say, most attorneys don't really want to bother with that because they're happy with the phone calls, and that's a lot less time and effort on both sides. But we've had a couple of Polycom/Zoom sort of setups that I've handled.
Okay, thank you. And so if they wanted to do that, they would have to work through you, and it sounds a bit more labor intensive.
It's actually really seamless. I mean, attorneys, it's like, it's just a constant flow. I mean, they understand what the process is. They go through it, and it's a zip, and we're done with it. I mean, it's not laborious at all.
Okay.
It's just time consuming on our side, but the attorneys, they know the formats now, so they know how to handle it, and they just call and we schedule it and take care of it. It's very seamless.
Thank you.
Any other discussion or questions on the visitation portion? Any feedback? Okay, we will then have this on the August agenda for future discussion, and we'll have the warden and his team send out any information regarding any policy or anything that they would need from us prior to that meeting, and we'll discuss it then at that point. Thank you very much, Chris. We appreciate that. Future considerations, anything else under this, Chris, that you'd like to tackle?
No, I mean, it's just we're taking one day at a time. I mean, I know right now we're pretty full with the individuals. Like our count took a nice spike for Tennant County. Bedford needed some assistance, as well as Schuylkill needed some assistance, and then Huntington brought us a nice group of people in. That our count's up to 162. I think this morning I registered. So from a month ago at 123, 25, we're at 162. Most of them are Tennant County inmates. Where we're at right now is where we're pretty stuck with our quarantine individuals, that we don't have many housings for quarantine right now. And then that's been our discussion with doing an antibody and the COVID testing simultaneously. So that's something that we may be looking into in the future if the board agrees to it. Just try and get them off quarantine a little sooner and alleviate some space at that time. I know we're getting tight right now. I think we might have, maybe male side, we have about 3 or 4 cells that are vacant. And I think the earliest anybody comes off is the 14th or 15th. 14th is our biggest group that comes off. So we're counting the days down that we don't get an influx of other from Huntington or even from Center County at this time, but we're maintaining our own on that sense with our quarantine.
Okay, thank you, Warden. Anything else the members of the prison board would want to bring up under COVID-19 future considerations? Any other feedback on that? Okay. All right, we'll move then into our monthly reports, and we will turn it over to Carrie. Good morning, Carrie.
Good morning. Just an update on our overdose deaths here in Center County. As of Monday, July 6th, we had 6 confirmed accidental overdoses, 3 suicides by overdose, and we have 1 pending toxicology results. So we are trending higher than we were last year, which has been the pattern for several years. But it seems to be on the increase. Here we are a little over halfway through the year. So my department isn't as busy with meetings as we normally are, but we are busy with grants. I'm working on 2 right now that are due this month. One related to COVID supplies, and then also one for our intermediate punishment program that's due at the end of the month. So that's all I have. If anyone has any questions.
Any questions for Carrie? Okay. All right. Thank you very much, Carrie. Thank you.
Thank you.
Prison Society, anything you'd like to report, discuss?
I'm good. Connie, do you have anything?
No, I don't. I had my say already. I'm good.
Okay. Thank you both. And Kathy from Centerpiece, anything you'd like to share?
Just that we're just taking it day by day over here. Our sales have been tremendous. We have traffic, no complaints in that area. And we're hiring extra help to come in and help. We have to, because it's just too much for the staff to handle. Donations through the roof, because when everybody has time on their hands, they go through their attics, their basements, their garages, and get rid of stuff. So that we appreciate that. And we're really one of the only ones out there that are delivering and picking up. So we are overwhelmed with that. But like I said, we're hiring extra help to come in until we can get our trainees back, and we anxiously await that day when it's safe for them to come back. That's it.
Okay. Well, thank you, Kathy. And we do want to obviously let you know, and we're letting all nonprofits made aware of this as we get into the weeks to come. But with the CARES Act funding the county received through the state, or from the federal government through the state, nonprofits will be able to apply for that. And so we will obviously make sure that you are aware of that and know how to apply for it. And because we do recognize the challenges that have been faced on Centerpiece during this pandemic. So we do want to make sure that you're aware of that. And again, we'll keep you up to date on when that's released.
Thank you. I appreciate that very much.
Absolutely. Absolutely. Okay. Before we adjourn, anything else that anybody wanted to bring up regarding anything before we, again, look to adjourn? Okay.
So, Michael, are you all going into executive session? It was on the agenda.
Yeah, we typically will have executive session on there just in case we need it. I don't know if we do today, Chris or Margaret, if that's going to be needed.
Not needed today from my
Yeah,
Okay,
thank you, Margaret. Yeah, so we would not be going into executive session. Okay, all right. And hearing no other conversation discussion, our next meeting will be Thursday, August 13th at 8 a.m. If there's no further discussion, would there be a motion to adjourn today's meeting?
Motion to adjourn today's meeting, Commissioner Higgins.
Second, Controller Moser.
Okay. Been moved and seconded. Any further discussion on adjourning? Hearing none, it's 8:46. All those in favor of adjourning, say aye. Aye.
Aye.
Aye.
Aye.
We are adjourned. Thank you, everybody. Have a nice day.
Bye.